So we're going to talk about something today called tendinosis. Tendinitis is something everybody's heard of. Itis, meaning inflammation, is just a tendon is irritated, and it's usually something that's acute, which means it's just recently happened, and with rest, it generally goes away. But what happens when tendinitis hangs around a very long time? You get a thing called tendinosis. And we could look here at our quick little Wikipedia definition, and that's going to be like, what the hell is going on? I don't understand this. So I'm going to break it down for you. A healthy tendon should look just like dry spaghetti. All right? All of our fibers running the same way. So when you ask them to stretch or fire, they all go in the same direction. That's a healthy tendon. But over time, with either a lack of oxygen or chronic overuse, these tendon fibers will change, which turns into tendinosis. So increased chronic inflammation, lack of oxygen, overuse, that leads to this, tendinosis, which is like instead of having dry spaghetti, that's like we have some dry spaghetti, but we also have some wet spaghetti. So now when you ask this spot to stretch out, some fibers still want to do this, but others want to do this. Or they'll want to stretch in all these directions, which means they don't. So you have this chronic tugging whenever you're trying to use that particular muscle or tendon, or load it, or you're going to be sore forever afterwards. It's because it is not ready to handle that load. Sometimes this is generally because this will happen due to other muscles around it not being healthy. So what you'd have to do primarily is figure out what those other muscles are, why this is being overused, and then get some exercise, get some strength and some blood flow back into these spots so we can promote the growth back to this, away from this. So we're going to get into a couple of those exercises right now. This isn't what you should do, the first thing you should do when it comes to tendinosis. It is a chronic problem. This is more or less for those patients that have already jumped over this hurdle, and we can go ahead and give them some rehab. So let's get into it. All right, so the initial goal of treating tendinosis or fixing tendinosis is going to be one, eliminating and making sure that there's no extra load going into that tissue. So if it's an ankle tendinosis, like Achilles tendinosis, make sure all those muscles around it are healthy. For the shoulder, make sure the rest of the rotator cuff is healthy before you hit that muscle. But here's what we're going to do. You got 3 quick exercises, and we're going just for movement, not so much for strength, right? We just want to increase the blood flow. So you got 3 movements. One, we're going to take a little towel here, put it under your elbow just for comfort, and we're going to just go ahead and open up here. So the elbow is going to rest. You're going to do this very simple exercise, no weight. Start with no weight, maybe go up to a pound, but you're doing sets of 30. Start off with 1 set of 30. If you're not sore the next day, go up to 2 sets. Move your way up to something close to 3 sets of 30. If you can do that and you don't really have any negative side effects, then you can move on to strength. So this is exercise 1. Next up, very simple. Here, up to here. These might seem like very simple exercises, but that's what they're supposed to be. Very simple. We're trying to get blood flow to an area that doesn't have a lot of blood flow. So this is all you're going to do. Nice and slow, deliberate, working on that nice full range of motion. You're going to do sets of 30 with that as well. Start with 1. If you don't have any soreness or anything like that after the next couple of days, then you can add extra sets. No more than 3 sets of 30. The last one is going to be straight out, going up. Once again, start with a set of 30, add on as you get better. When it's time to go to strength, once you've gotten that, then we can add more resistance, use a weight in your hand. You're going to cut down the number of reps and just increase the resistance, and then we can build strength. But first, we need to focus on getting that blood flow. So you can use the same 3 exercises, just use them with different focuses. Blood flow first, than strength.